Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everybody, and welcome to episode 86 of the Hair Loss Show. I'm Dr. Russell Knudsen.
And I'm Dr. Vikram Jayaprakash.
Today we're going to talk about a female congenital high hairline, and as a very good sport, our practice manager has agreed to be the model today. So I'm emphasizing she's not a patient, she is our practice manager who has a natural high hairline, which by the way doesn't bother her in the slightest, so we're just using her as a demonstration. We get asked about this quite a lot from young women, about how to deal with a hairline that they've always hated because it's high. So facial balance for women is a little bit different to facial balance for men. We still roughly apply the rule of thirds, meaning that under the chin to under the nose is the lower third, and from the middle of the eyebrow to the forehead, the line here, hairline, is roughly the same. In women, typically that would be 55 to 60 millimeters above that point that we're talking about in the mid-eyebrow line. In men, it typically starts at approximately 70 mil. So we're talking about 10 to 15 mil lower in a female than in a man. And the thing about natural hairlines is that when the forehead goes from being predominantly vertical, it goes into oblique and then it becomes horizontal. And when balding men retract their hairline, it gets back to the horizontal, it looks abnormal. And that's why when we're seeking to do a hairline for men, we're bringing the hairline somewhere onto the oblique, not onto the vertical. So if our practice manager here was saying to me, I want a lower hairline, what do you think? Because this is actually a little bit higher than normal, we could bring this down to a level that probably just suits the patient without crowding the forehead. And so we don't have to worry, because this is something that they were born with, about the hairline retracting behind or about future hair loss. We just have to worry about what the shape is. I'm going to use a comb just to show what we have in the corner here. So it's high in the corner and there's a little bit of retraction in here, which is hidden by the hairstyle anyway. So a feminine hairline comes around the corner in a more rounded version, doesn't have a sort of a square or a W shape to it, and would come down somewhere into this region here. If I just do a sort of, this would change the shape. It's not on the vertical part, it's not up here, it could be somewhere here, but it would come here and would come around the corner. Now there's two techniques that can be done to do it. I'm going to talk about the first one, Dr. Vikram's going to talk about the second technique. There are certain plastic surgeons in the world who've been trained in the technique of making an incision at the hairline. They sort of free up the tissue using natural flexibility behind, and then they drag the whole of the hairline forward and sew it into place in the new region. And you can usually get 10 to 15 mil of advancement using that technique, you know, with an experienced surgeon who knows how to do it. So that's the good news, because you get an instant result. The not so good news is that it leaves you with a scar right at the hairline itself, which might be visible and might need grafting later on to cover it. The other problem area is the corner, because this corner is retracted higher behind that. So getting that down to here with that technique might not make this particular patient ideal for that particular technique. But there are doctors who do it very, very well. There is a bit of a problem in the corner, but it does give an instant result. And sometimes the patient's very happy with it. Sometimes they say, oh, the scar's a bit visible, can we do a bit of grafting? Now, if they're not particularly keen on that forehead or hairline advancement technique, it's called the hairline advancement technique, which is really a flap of skin moving forward where this piece of skin is cut out and removed, and this point is joined to this point. So that's the instant fix with the hairline advancement. The alternative is
actually having a hair transplant, which is moving, essentially like we do with men, moving hair from one part of the scalp to another. But instead of moving a strip this time, we're moving the individual hair follicles. Now we can do that either by cutting a strip from the back of the head, and that's called FUT, or we can take the follicles individually one at a time. But in essence, what we're doing is rebuilding a hairline, and we've got to design the hairline first, and that we can now customize the hairline to what.
So that would be an advantage with this technique.
Correct.
Is that you can get any particular shape you want, because you just draw the shape and then you graft to that shape.
Absolutely. So we need to have an understanding of what female hairlines are like in nature, and what the patient is looking to achieve. Are they looking at bringing those corners, for example, down and into a more flatter, rounder hairline? Women generally have a more rounder hairline than men who have normally have a degree of recession in the corner. But essentially what we're doing is we're taking hairs from generally the back of the scalp and then transplanting those follicular units one at a time in the shape that we want, and then waiting for them to come through and grow.
And I've got to tell you that we're getting increasingly asked to do this kind of surgery, particularly with young women, and it's very successful. And the secret is to get enough density, to get the hair direction right, and to get the framing of the face right, because women like to have a variety of hairstyles, right? So with men, they either flick it back or they flick it to the side. That's pretty much what happens with men. With women, they might want to separate it in the middle, they might want to separate it from the side, they might want to flow it back. There's a lot more variety in hairstyles that women like to do. So again, there are options for women out there that are unhappy with their high hairlines, that they need to go to an experienced doctor. This is not for beginners to do this surgery, because it really requires refined hairline design and refined hairline execution. But we have many delighted patients because we've been able to get past this thing that's bugged them their whole life, knowing that they're going to get a long-term benefit from
Absolutely.
it.
They love the end point, the outcome. But I do, the only other thing I want to add is that we do spend a lot of time during that consultation phase discussing what that interim period looks like, because we have to prepare the patient that if they're having a new hairline drawn and grafted, there's going to be a period where there are short stubble hairs that are there, and we're waiting for those.
That's where the bangs coming down across
Correct.
the forehead.
So we have to talk about how we
style
style
it. Wear
it.
a hat.
Yes. So we have to talk about what they're going to be doing for the next 12 months, be it scarves, headbands,
mostly
whatever.
it's the first 6 months is the tough 6 months. Once they get through that, the second 6 months is more refined. But yes, it's not an instant fix, but grafting does offer the advantage of no scar at the front, and does offer you the advantage of customized hairline design, which is a lot more flexible when you're grafting compared to doing the hairline advancement technique.
Yeah, but it's a great outcome. And we've got lots of really happy
So I hope that helped clear up that question for you, because a lot of women didn't know that this was possible, that they could get a hairline that was more suitable for framing their face, because like men, women have different shapes of face, so different shapes of hairline suit different shapes of face and foreheads differently. I hope this has been helpful for you. Thank you very much for your subscribing and for your views. Keep up the good work, and we look forward to seeing you on the next episode.
Thank you very much, and thank you for
helping us today.
See you next time.
Bye.